If you are dealing with sciatica pain right now, there is a very good chance you have already spent time searching for answers online. And if you have probably come across a lot of the same advice repeated over and over again. Advice that, despite how widely it is shared, may actually be making your situation significantly worse. Today, I want to talk about the things you must stop doing if you have sciatica. Because in all my years working with patients over 60 dealing with nerve pain, some of the most common mistakes I see are not things people stumbled into randomly. They are things people were actively told to do by videos, by blogs, sometimes even by well-meaning friends and family. And if you have recently been diagnosed with sciatica, or if you have recently started noticing that burning, shooting, traveling nerve pain for the first time, this video is especially important for you because what you do in these early stages matters enormously for your long-term recovery. Now, I want to be upfront with you about something before we begin. Some of what I am going to share today may feel counterintuitive. Some of it goes directly against what you have read elsewhere. But everything I am sharing is grounded in science, backed by research and drawn from years of clinical experience working with real patients who came to me after doing the wrong things and wondering why they were not getting better. So let us start at the beginning, because before we talk about what not to do, I want to make sure we are talking about the same thing. What is true sciatica pain? The sciatic nerve originates from nerve roots in your lower lumbar spine and upper hip region. These roots join together to form the sciatic nerve, the longest and widest nerve in your entire body, which travels through your deep hip muscles down the back of your thigh, and at your knee splits into two branches that continue down the back and side of your calf, sometimes all the way to your toes. True sciatica pain follows this path. Lower back, deep hip, back of the thigh, back or side of the calf, sometimes into the foot. Now, here is something important that many people do not realize. If your pain is traveling down the front of your thigh or the side of your thigh rather than the back, what you are experiencing is likely not true sciatica. It may be a different nerve entirely. And this distinction matters enormously because treating the wrong nerve with the wrong approach does not just fail to help. It can actively cause more damage to the tissue that is actually irritated. So before you follow any advice, including what I am sharing today, take a moment to honestly trace where your pain travels. If it follows that path I described, lower back, hip, back of thigh, calf, then yes, this conversation is for you. Let us talk about what you need to stop doing right now. The first thing to stop doing is applying heat to the area. I know heat feels good. It is comforting. It is instinctive. When something hurts, we want warmth. And I completely understand why so many people with sciatica reach for a heating pad and place it on their lower back or hip. But here is the problem. Heat increases blood flow. And while increased blood flow sounds beneficial, and in many situations it is, when your sciatic nerve is acutely inflamed, increased blood flow means increased inflammation. And increased inflammation around an already irritated nerve means increased pain signals traveling up to your brain. Your sciatic nerve is not like a sore muscle that responds well to heat. It is an inflamed neural structure that is already being bathed in inflammatory compounds. Adding heat to that environment is like adding fuel to a fire that is already burning. What you want instead is ice. I know ice feels less appealing, especially for those of us over 60 who often find cold harder to tolerate. But research shows that even just 3 to 5 minutes of ice application is enough to achieve meaningful pain inhibition and help calm the inflammatory response around the nerve. You do not need to endure long sessions. A brief, consistent application is what the evidence supports. Set aside the heating pad for now. Reach for ice instead. Your sciatic nerve will thank you. The second mistake is resting for too long. Now, this one is nuanced, and I want to be careful here because I am not telling you to push through severe pain or force yourself to move when your body is clearly asking you to stop. There absolutely is a place for rest in the early stages of sciatica, particularly when the pain came on suddenly and sharply, which often indicates a disc herniation pressing against the nerve root. In those early days, your body genuinely needs a window of relative rest, usually 1 to 3 days, sometimes a little more depending on the individual, during which you focus on gentle icing, finding positions that ease the pain, and allowing the most acute phase of tissue, irritation, to settle. Attempting to walk it off or exercise through it when a disc has just herniated and the nerve root is acutely compressed can make things significantly worse because you are moving with a compensation pattern, your body protecting itself, and that abnormal movement puts additional stress on already damaged structures, so rest when your body needs it. But here is where so many people go wrong. They rest far too long. For many years, the standard advice when someone received a sciatica diagnosis was complete bed rest for 2 weeks. We now know that was wrong, profoundly wrong, because every tissue in your body is designed to heal through movement. Your lumbar discs do not have their own blood supply. They receive nutrients through the pumping action of movement. Your muscles maintain their strength and coordination through use. Your nervous system learns to regulate pain signals through normal, gentle activity. When you rest for 2 weeks, everything stiffens, muscles weaken. The pain often feels worse when you finally do try to move because your body has become even less prepared to handle it. So, what is the right approach? Rest for as long as you genuinely need to in order to be able to move without a significant compensation pattern. Then begin gently reintroducing movement, even if it is just getting up from your chair once an hour to walk slowly around your home. Even if you can only manage 1 or 2 minutes of normal walking at first. Work up gradually. Let your body guide the pace, but do not stay still any longer than necessary. The third thing to stop doing, and this one surprises almost everyone, is stretching the sciatic nerve. I say this because one of the most widely recommended exercises for sciatica across the internet is the hamstring stretch, and I understand the logic completely. Your hamstrings feel tight. Stretching tight muscles relieves tension, so stretching your hamstrings should help, right? Here is the problem. When you stretch your hamstring on the side of your sciatica, you are not just stretching muscle, you are also stretching the sciatic nerve itself. And nerves, particularly inflamed, irritated nerves, do not respond well to being stretched. In fact, stretching an already inflamed nerve increases its irritation and worsens the inflammatory response. Many people notice this exact pattern without realizing what is causing it. The stretch feels good in the moment. There is a brief sense of relief and release, but then later in the day, or when they lie down at night, the pain is noticeably worse. That is the delayed inflammatory response to nerve stretching making itself known. If you are in the early acute phase of sciatica and you feel an urgent need to stretch something, stretch the opposite side instead. Stretching the non-affected leg can actually help reduce some of the tension being placed on the irritated nerve without directly aggravating it. There may come a time later in your recovery when the acute inflammation has calmed, where some careful hamstring stretching becomes appropriate and even beneficial. But in the early stages when that nerve is hot and angry, leave it alone. The fourth mistake is attempting self-traction of the lower back. Self-traction refers to any technique designed to create a pulling or decompressing force on your lumbar spine. This includes inversion tables, devices that tilt you upside down, as well as lying with your lower body hanging off the edge of a bed or couch to create a stretching force through your lower back. I see these recommended frequently online for sciatica, and I want to be very clear about this because for some people in some situations, traction can have value. But for someone in the acute phase of sciatica, when the nerve has flared recently and inflammation is high, self-traction is likely to make things worse. Here is why. When your sciatic nerve is acutely inflamed, your body does not have the muscular stability to safely manage the forces that traction creates. The decompression may feel wonderful in the moment. You may feel immediate relief while inverted or while hanging. But once you return to an upright position, the increased inflammation that follows can be significant. Inversion tables carry a particular caution for anyone with known disc instability. While they do create space in the spinal joints, they simultaneously reduce the stability of the disc, which means the relief you feel while inverted quickly reverses once gravity returns to normal. For those with disc herniations, this can be genuinely harmful. If you have been dealing with chronic long-standing sciatica that is more of a dull, persistent ache rather than an acute flare, some forms of gentle traction may eventually have a place in your recovery. But please do not attempt this on your own without professional guidance, and absolutely not during an acute flare. The fifth mistake is doing back exercises or stretches in either direction. Let me explain both sides of this. First, lower back stretches, bending forward, pulling your knees to your chest, doing spinal flexion exercises. These movements stretch the structures of your lumbar spine, and in doing so, they also stretch the sciatic nerve. As we have already established, a hot inflamed sciatic nerve does not want to be stretched. These stretches may produce a brief sensation of relief. The muscles and joints loosening feels good momentarily, but the increased pressure on the nerve that follows is not going to serve your recovery. On the other side, back extension exercises, bending backward, activating the large muscles that run along your lumbar spine. This is also widely recommended online for sciatica. The reasoning is that strengthening the back muscles will support the spine and reduce pressure on the nerve. And again, the logic sounds reasonable, but here is what actually happens. When you activate those large lumbar muscles, they contract and compress. They put direct pressure on the spinal joints and the discs. If a disc has just herniated and is already pressing on your sciatic nerve root, adding compressive force from strongly contracting muscles is going to increase that pressure, not reduce it. I am not telling you that you should never exercise with sciatica. Exercise is important and movement is medicine, but the specific exercises matter enormously. During the acute phase, avoid both strong spinal flexion and strong spinal extension. Focus instead on gentle, neutral spine movements that do not place excessive demand on the lumbar structures. Work with a qualified professional to identify what is appropriate for your specific situation. And the sixth mistake, the one I feel most strongly about sharing with my community, is rushing into surgery without fully exhausting your conservative options first. I understand the desperation that drives this decision when you have been in severe nerve pain for weeks or months. When it is disrupting your sleep, limiting your movement, affecting every aspect of your daily life, the idea of a surgical solution that promises to end it feels enormously appealing. I have sat across from patients over 60 who told me they would do anything to make the pain stop. I understand that completely. But here is what I have seen over and over again. Surgery addresses the structural problem, the herniated disc material, the bone spur, the narrowed canal, but it does not address the underlying reasons why that problem developed. Why did the disc herniate? Why has the canal narrowed? What movement patterns, postural habits, muscle imbalances, and lifestyle factors contributed to the situation in the first place? Surgery cannot answer those questions. And without addressing them, the same forces that created the problem the first time continue to act on your spine, often leading to repeat procedures. I want to share something with you that I think about often. There is a well-documented phenomenon in spinal surgery where a herniated disc that appears on an MRI will actually be reabsorbed by the body over a period of weeks to months without any surgical intervention. The body has a remarkable capacity to resolve its own disc herniations when given the right conditions for healing. This is not rare or unusual. It is a recognized biological process, and it means that the MRI finding that looks alarming today may look very different in 8 or 10 weeks if the right conservative treatment is given a genuine opportunity to work. This is not to say surgery is never appropriate. There are genuine emergencies, loss of bladder or bowel control, progressive weakness in both legs, severe neurological compromise, where surgical intervention is not optional. But for the vast majority of people with sciatica, even severe sciatica, surgery should be the last resort after a thorough course of conservative care, not the first response to a frightening MRI. Give your body time. Give conservative treatment a real and consistent opportunity. Work with qualified professionals who understand nerve pain, and do not let fear or urgency push you into a decision that may be irreversible before you have truly exhausted your other options. So let us bring everything together. If you have sciatica, whether it just started or has been with you for a while, here are the 6 things to stop doing right now. Stop applying heat. Use ice for 3 to 5 minutes instead to reduce inflammation and inhibit pain signals. Stop resting too long. A brief window of rest is appropriate in the acute phase, but get moving gently as soon as your body allows normal movement patterns to return. Stop stretching the sciatic nerve. Hamstring stretches on the affected side stretch the nerve itself and increase inflammation. Stretch the opposite side instead if you need relief. Stop attempting self-traction. Inversion tables and hanging techniques may feel good in the moment, but worsen inflammation and reduce disc stability, particularly dangerous during an acute flare. Stop doing back exercises in either direction during the acute phase. Both forward bending and backward extension exercises can increase pressure on the nerve root when inflammation is high. And stop rushing toward surgery. Your body has a remarkable capacity to heal when given the right tools, the right time, and the right guidance. I know that sciatica is one of the most frustrating and discouraging conditions to live with, particularly after 60 when recovery takes more patience and the pain can feel more relentless. But I have seen patients recover fully from situations that looked hopeless. And I believe that with the right approach, consistent care, and a willingness to work with your body rather than against it, you can get there too. Leave me a comment below and tell me which of these mistakes have you been making without realizing it. I read every single comment from this community, and your questions genuinely help me understand what to bring you next. If this video was helpful, please share it with someone you care about who is dealing with sciatica, and subscribe to this channel if you have not already, because every week I am here with honest, practical, evidence-based health information designed specifically for life after 60. I am Dr. Emily Carter. Take very good care of yourself, and I will see you in the next